Jackie again, your midwife, and I am here to advocate for good pregnancy experience. So, are you planning to get pregnant in 2025? How do you plan about it? Remember, we are in the era whereby we plan for pregnancy and we prepare for it to have a good experience. So today we want to talk about how can we prepare for pregnancy and make the experience better, more orderly and good. Yes, so let us begin. The first thing you want to do as you prepare for pregnancy this year, start with a preconception clinic or preconception care clinic. Now, preconception care is an important aspect in antenatal care. Remember, we want to have an informed mother, one who is prepared and set for the pregnancy. There are issues that sometimes affect us when we are not prepared, and we shall see what those things are. So attending a preconception clinic helps you to interact with your midwife or your obstetrician. It helps you to prepare yourself both health-wise and in all other aspects in terms of knowledge, getting knowledge. And remember, preconception care clinic, we do it together as partners. You do it with your partner. So go with your partner to the clinic. Go tell your midwife, inform them you want to get pregnant. Let some tests be done on you, get ready for it. And we shall be talking about what will be done in preconception clinic. Second thing, mental health stability. You want to have a mental health self-care. Before getting pregnant, we want to be very stable in our mental health. Why? Because there will be a lot of change in hormones. We need to make decisions that are sounded good. You want to reduce the chances for pregnancy depression or postpartum depression. So you check on yourself, get to understand, do I have maybe some mental health challenges? Did I have some maybe stress or something affecting me from what maybe I've gone through, other things or aspects of life? So we want to settle from that. If you feel you're not mentally stable, you can go share with your friend, share with psychologist. If you find it necessary, just go even to a hospital. Get pregnant when you're mentally stable. This one helps you to manage yourself better and to cope with maybe a few challenges here and there in a better way and a more organized way. So that is the second thing. Number 3, you want to avoid alcohol. If you take alcohol and if you take it on a regular basis, it is important to know that pregnancy and alcohol abuse do not go together. This is because it affects you as well as affects the child. So it is important to start weaning off from alcohol until you are stable enough and you feel you're okay without it. And that time you can get pregnant. So take care of your alcohol intake. Get help where you can. If you're addicted or you have some issues that push you to take alcohol, and that one can be solved with your healthcare provider. Yes, and it comes better. Number 4, we need to do a financial preparation. Remember, pregnancy comes with needs. You don't want to be pregnant and lack what you want. Like if you realize you're getting bigger, you need a dress. You don't have money to buy the dress. You realize you need a good diet. You're not able to buy, maybe to acquire some food for that. You want to go and maybe go for an outing just to feel better because you don't feel good. You need to be able to do such things. So have some savings specifically for pregnancy. You realize there are other things you may also want to do depending on your interests. There are things that are not necessary, very necessary for everyone, but you may want to do them. For example, going out. Maybe you want to swim when you're pregnant. You want to enjoy your moments when you're pregnant. You would want to go and enjoy time with friends. You need money. So do a savings specifically to take care of your pregnancy needs. Even getting prenatal supplements. You may want to get them and probably your insurance cover does not deal with that. So remember that one may need you to have savings. So it is important to prepare well financially. The other thing you want to do is to take prenatal vitamins. Prenatal vitamins are part of what you'll be offered in your preconception clinic. But in case you have not visited the clinic for preconception care, we start prenatal vitamins before pregnancy. And the reason is that we need the supplements, we need the nutrients, we need things like folic acid earlier before you get pregnant. By the time you're conceiving, you need to be taking folic acid. So you need to start your vitamins as early as you can, and so that you get better. And of course, you can always consult, depending on your location, consult from your midwife or your obstetrician on which vitamins will fit you best. Then you need to track your menstrual cycle. Remember, you want to understand what times am I fertile, what times can I be able to conceive. So it is important to start tracking your menstrual cycle, and this one also will be assisted. You can be assisted by your midwife, your obstetrician, your healthcare provider to track your cycle and understand your fertility times. Then we need some lifestyle factors of changing. Remember things like diet. Now it's not time for junks. It's not time for not taking drinks. If you're not hydrating, you're just taking junks, remember you need to start changing your lifestyle. Getting a bit active in terms of your movements, unless stated otherwise. It is good to prepare yourself by ensuring your lifestyle is modified, including drug and substance abuse, including your social life. How many sexual partners do you have? Remember, during pregnancy is not a time to play around with everyone. You need to be somebody who has a stand, you know your partner, you know you're safe. Even your health-seeking behavior also becomes important, because in pregnancy or before pregnancy, you need to be somebody confident to get to the hospital, get a pregnancy, get a body checkup, and yes, be prepared for conception. And the other thing, you avoid the environmental toxins. Like in your workplace, if you work with things like pesticides and chemicals, if you work with chemicals and maybe things like pesticides, you need to get some advice on now. What can I be exposed to? What can't I be exposed to? Avoid these toxins. Now, remember, as you get pregnant, it is a time that you should celebrate, a time that should be easier for you. And remember also to be socially connected, so that you have people to support you, including your partner, your parents, sisters. Call them on board, let them be there to advise you, share with other people who have been pregnant. Get the feeling from them, and especially if you are a first-time mom, get the feeling of others, and this one will help you a lot to know what pregnancy could be like. So thank you very much. I wish you all the best in your readiness, all the best in your pregnancy. May you conceive well, and may you have a wonderful time, mom to be. Bye.